Good afternoon, friends, colleagues. And before we talk about leadership, I wanted to, or before we talk about policy, or before we talk about the future that we can envision, I wanted to recognize first the reality that many of our communities are living today, and that these are difficult times. And I wanted to highlight that. And sometimes they are difficult in some just slow cooking way, as opposed to sudden, every now and then we have very difficult things that happen, and they're very visible, and sometimes they're less visible, a little bit more invisible and just happening. Recent national surveys that tell us that they were done by both the Pew Research Center and the Hispanic Federation, tell us that nearly 7 in 10 Latinos believe that the situation facing Latino communities in the United States has worsened. Nearly 1/3 report difficulty obtaining or paying for medical care, and more than 1/3 have struggled to pay for food, for utilities, or have had to borrow money simply to make ends meet. And I don't know about others in this group right now, but I see it in our office. And our social worker helps me a lot. Anne Fields, who's here as well, she helps us a lot with connecting people to resources in the community. But I'm seeing more frequently, and I often, as a Spanish speaking person, I take care of a lot of members of the comunidad latina, personas que hablan español, and often very proud community members who don't want to ask for a handout, for charity, for help, but times are difficult for many, and I just wanted to acknowledge that. Many families are carrying tremendous burdens that include economic uncertainty, fear, questions about access to health care, questions about whether they can afford insurance, questions about whether it is safe to seek care. Many Latino families had gained health insurance for the first time through the Affordable Care Act. Yet many of those gains are now at risk because of rising premiums and because of changes in policy. Some families may see healthcare costs increase by thousands of dollars each year, and that makes it much more difficult to access healthcare. Another significant percentage of working Latinos were able to gain insurance through the Medicaid expansion, and many are starting to lose the coverage. And so when we think about these numbers and these statistics, we just, when I look at the numbers, I keep thinking about what these families, that this is affecting. These numbers are families, they are community members, they are our own nuestras propias familias. And the financial concerns are only part of the story. Many immigrant families are also living with another burden, the burden of the uncertainty and fear, both because of being mixed status families, but also because just looking Latino puts you at risk, or speaking with an accent puts you at risk. And I think it's important to name it. There's fear about what the future may hold, and at the same time there's resignation. It's like, okay, if it happens, si algo pasa, me voy. Fear of family separation, fear of interaction with institutions, fear of seeking care. And I want to highlight that the fear itself can become a social determinant of health that perhaps needs to be named as in itself, right? Because fear paralyzes people, even people with citizenship. El miedo, the fear, it can be paralyzing. And so I would just want to recognize that these are difficult times and that many of us are tired, many of us are worried, many of the communities we serve are worried, families are asking difficult questions, we are asking ourselves difficult questions, community organizations feel stretched, healthcare systems are also changing. I see less signs in Spanish. I see um, policies that are changing. And some days it can feel as though we are once again navigating uncertainty, just like it happened in the pandemic. And I suspect that many of us during this time have asked ourselves, can I keep doing this work? Am I making a difference? Who is working this journey with me? So today, before anything else, I want you to think about who we're walking this journey with, who is in the room today, our virtual room, and then all of the different rooms in which we participate. And think about all of our colleagues, our partners, our community, and people who continue to show up every day because they believe that healthier communities are possible. And I think that matters to think about that we are not alone, de que no estamos solos, because none of us can do this work alone. None of us can do ese trabajo solo. And so even in difficult times, let's remember that we have each other and that we have a community that started to join together 6.5 years ago, and that we continue to join to share and to connect and to do the work. And I want to think about that and what it means to have created these relationships that in a way became a form of public health infrastructure. If we think about what Latin 19 became during COVID-19 and perhaps what we're doing every Wednesday that we still show up is to really recognize that in times of uncertainty, these relationships, this connection with each other becomes a form of a public health infrastructure. It becomes a form of connection that is so necessary to maintain health. So if you think about March of 2020, when many people were frightened, when information was changing every day, when our communities were disproportionately affected, and then this remarkable Wednesday noon meetings started to appear, people started showing up. And then something remarkable happened. We created this. We joined together community activists, community health workers, community members who became community health workers, community leaders, researchers, public health professionals, clinicians, educators, faith organizations, students, and advocates. We all got together. And we didn't wait for permission to get together. We started helping, we started learning. So Latin 19 was born in that moment as a volunteer-led coalition that brought together thousands of people because our communities needed us. And then we were brought together by COVID-19, but it is not, COVID-19 is not what kept us together. Relationships kept us together, trust in each other, and trust in the new people that came in later brought us together. And Perla says that is what a culture does. Yes. And we also brought together with us people from other different cultures that started seeing the importance of working together and being together, creating this form of infrastructure. So this goes back to the title of my conversation
Viviana,
today.
if I may interrupt, I'm so
Sí,
sorry.
por favor.
I'm not in front of my computer,
Yes,
so
sí,
but
sí,
I'm on
sí.
my phone and I'm looking at the slides too. And I just want to say that um, we created what you created. This was your baby, a safe space for everybody that could come. Didn't matter who they were, what language they spoke. It was a safe space during COVID to ask the questions that they were afraid to ask, to hear what those answers were from spaces that were not judgmental, right? So I think that's where it all started. It was a safe space. And I can't thank you enough for that. So I just wanted to say that before you
Thank,
continued.
thank you, Perla. And I think it's worth coming back to it because we are living in a moment where our community needs a safe space over and over again. And this also goes back to the title of my conversation. One thing we all learned together uh, as we created Latin Team is that none of us has all the answers, but together we ask better questions, and together we find better solutions for things that are happening. And this is why I think many of us continue to come back. Um, so I wanted to start with a conversation, and I hope that there's about 18 people in the room today. Um, I would like to hear from you. When you hear the word leadership, what comes to mind? And you can put it in the chat, or you can raise your hand, or just unmute and say it.